Hey, so chances are if you are watching this video, then you are a male that recently has been diagnosed with urethritis. Now, what is that mean? Urethra, which is the first part of the word, means the tube that comes out of your bladder that you essentially pee out of. And itis is inflammation. So inflammation of the urethra in a male is urethritis for this video. Now, women can also have this too, but since we're specifically talking to men, that's what you have been diagnosed with. Now, for many, this is kind of like an umbrella term for those of you who are experiencing pain in the penis, maybe burning with urination, or any type of like nerve, just pain that doesn't make sense that's in the penis. And what we have seen is that if you have seen your urologist and they've kind of diagnosed you with it because they can't really figure out anything else that's wrong as to why you're having pain in this area, then this is the video for you. Because if they actually found that you truly have something going on, then they're going to treat you. Maybe you've been treated with antibiotics and medications, but you're still continuing to have pain in the penis and in the urethra. And so what's going on with that? So hopefully for some of you, this video makes sense and it starts shedding some light on what might be going on. Now, before we kind of dive into the nitty gritty, I need to teach you a little bit of anatomy because that's going to be important. I'm Hina Sheth. I'm actually a physical therapist that specializes in orthopedics and pelvic floor dysfunction. I have over 25 years of experience, and our clinic here in Philadelphia treats chronic orthopedic pain as well as pelvic pain in both men and women. So I have a lot of experience. So because I'm a physical therapist, we are going to be talking mainly about a lot of how muscles within the pelvis can actually contribute with pain in the penis or discomfort in the penis that can also lead to, for many of you, bladder pain as well and pain with potentially urination. Now, if we look at the structure of the pelvis, here is your spine, here are the two love handles, which are your pelvic bone, and in the front is your pubic bone. So you can see this is a circular type structure with kind of like a bowl in the middle. And within that bowl, lining it is all this red musculature known as your pelvic floor. And you can see from the understand, now this is a female model, male model is no different, just pretend that there's a penis here. You can see here that it has attachments from the pubic bone to the tailbone to both sides of the sit bone. So for many of you, when you sit, you're actually sitting right on these muscles, and it ends up potentially also contributing to the pain in the penis you'll have, and we'll talk about that, why that happens. But basically, these muscles can play a really important role as far as why you might be having pain in that penile kind of area. And then it's not just penile area. This could be anywhere. For many of you, you might also be having scrotal pain. You might be having testicular pain. You might be having pain in the rectum or behind the prostate. So it's all kind of the same idea, is that you can have pain in any of these areas. And sometimes it can move around. Sometimes it's in the penis, and sometimes it's like it's not in the penis, it's in the prostate. So just realize that this musculature, when it becomes problematic, it can actually give you pain in these areas. And this is why when you go to your urologist and you have these tests and they don't find anything, that many of them don't realize that it could be this, or that these muscles in particular need the focus and the attention. And for many of you, maybe you have been diagnosed with something. Maybe there was an infection. Maybe there was a true urethritis because of something underlying. And maybe you got it treated with antibiotics, but that didn't help. And don't even get me started on antibiotics and how that mucks with the GI system. But many of you probably did that, perhaps for like weeks and months, and it hasn't changed anything. And if anything, things have just continued to get worse. So when these muscles become problematic, what do I mean by problematic? Now, these muscles are basically 14 muscles that, like I said, line the pelvis, but they also give function, all right, for many of the important pelvic organs. So now, again, this is the female model, but same idea with a man. This red line is depicting a simple description of the 14 pelvic muscles that attach from your tailbone to your pubic bone, and you can see that they go through a lot of these important organs. So the rectum, the bladder, and for men, of course, your sexual organs. And so if they go through here, if any problems arise within this muscle, they can affect the way you urinate, the way you have sexual functioning, and also the way you have potentially a bowel movement. And when I mean problematic, what I mean in this particular instance is that these muscles, and again, there's 14 of them, they can actually develop tension, spasms, and something called trigger points, which are basically essentially knotted, band up, like knots within muscles. They can form those trigger points, and those trigger points can actually cause pain locally where that knot is, but it can also refer pain into other areas away from where that knot is. A prime example, which I use all the time, is that if you reach over to your upper trapezius and you feel around, you probably have a knot there. Feels good to massage it. Sometimes for some of you, it's going to cause you local pain, but for some of you, if it's really bad, it's going to give you like head pain and shoulder pain and chest pain, you know, other scapular pain, things like that. That is a trigger point, and that can exist in any muscles within the body and definitely within the pelvic floor muscles. And so if you have tightness and restrictions in any of those muscles, this could be contributing to what feels like the penile pain that you're experiencing, that now someone's just kind of thrown a urethritis diagnosis at it, but that's not necessarily what's truly going on. Now, these pelvic floor muscles, the reasons why they can get tight can be for several different reasons. Orthopedic changes and postural changes from when you were very young, sports injuries, other injuries, lifting injuries, going to the gym, car accidents, sitting at a desk all day. So many different things can throw postural stuff off. Even like ankle sprains that you don't even think about can end up changing the way your whole body sits. So if we look at this picture, you can see that if your posture is off in alignment, it can affect any muscles within the body. And that includes muscles of the pelvic floor. Because remember, it's not just one muscle, it's a group of 14 muscles. So some of those muscles, depending on how your posture is and the balance of your body is, and the alignment of the pelvis and all the muscles around it, that can actually end up affecting these muscles within the pelvic floor. Now, these pelvic floor muscles don't work alone. I always say the pelvic floor is kind of like the goalie on a soccer team. You can't just have a goalie for a soccer team to win a game. You need a team. So there are other groups of muscles that work with the pelvic floor, and they guide it, they direct it, they help it. They can also cause problems if there are imbalances around any of these muscles that actually attach to the spine, to the pelvis, to the hip, to the inner thighs, because the pelvic floor sits right inside of that bowl. So you can imagine if there's restrictions and tightness and imbalances on one side of the body, it's gonna throw the other side of the body off, including different muscles of the pelvic floor. And when that imbalance is there and you develop tightness within different muscles, that can lead to trigger points. And those trigger points can then cause localized pain or referred pain, and that referred pain could be going into the testicles, into the penis, into the bladder, into the prostate, into the rectum. So just realize that we're talking about a soccer team, with the goalie being the pelvic floor. So postural changes is one thing that can happen, but stress can also end up creating tightness within these muscles. Infection. So like I said, if you had something that the urologist actually found and you were treated for it, that infection, even though the infection is gone and you no longer should be on the antibiotics, if you're continuing to have pain, then it could be that that inflammation actually created tensioning in these muscles. And this can happen because nerves in your body, from organs to musculature, actually communicate and talk to each other. So if there was an infection, it's kind of like a bad apple spoils the bunch. That infection will actually affect these pelvic floor muscles and the surrounding pelvic muscles and create trigger points, okay? Now, these are just some examples. There's lots of different reasons why somebody can develop trigger points within their pelvic floor, but these are just a few examples. Now, I'm sure at this point in time, you're like, Hina, stop talking. What do we do about it? So basically, if the idea is that there's imbalances around these musculature, both in the pelvic floor and outside around the pelvic, the low back, and the hip muscles, then the idea is, well, if we create that balance and you take the tension out of these muscles, then the trigger points calm down. You get better blood flow into these areas that are balled up, knotted, and spasmed that are also affecting nerves in this area. And if you open them up, you allow the blood flow to start getting there again. Well, now your body in these muscles can actually start repairing themselves. And if they start repairing themselves, they heal, the pain goes down, things start to feel much more balanced, much better. You're not as stressed out because pain will also create that stress cycle again, which just feeds into tightness of muscle. So how do we do this? Well, a lot of people, I'm sure there's lots of different YouTubes and Instagrams out there. It's like, release your pelvic floor. Well, some of those might be great and that might do it. But what we've seen at our clinic, because like I said, we've been treating this for years and years and years, there are common muscles that we see all the time in our clinic that tend to get tight, including those pelvic floor muscles. So what we did is we created an online program when COVID was going on because a lot of people couldn't make it to our clinic. That program was so successful and helped so many people around the world that we ended up just making it more detailed, making it more comprehensive, super clear and easy to just go through. And we created a 40 video kind of comprehensive guide to how to start releasing these muscles yourself at home. And for many people, just starting on some of the simpler things, because we go through indirect techniques of how to release your pelvic floor and direct techniques to release your pelvic floor, as well as how to release all of these many common muscles that also contribute to these imbalances and what's going on. Once you start working, even on the first few videos, most people will start to feel and see a difference. But it really is meant to be a 6-week kind of program. You do about 20 minutes a day. It really helps you understand your body, what's going on. And chances are, if you have this, you might also be having other symptoms that we talked about: bladder, rectal, low back, hip. And it's meant to also address a lot of that too. So don't be surprised if you end up taking the program and all of these other things start to improve. So if that is something that you're like, oh my God, I want to start that, I want to do it now, then that link is down in the description box below. And that also comes with potentially a consultation that you can also piggyback on. But if you're just looking to talk to us first, then there's also a direct link on how we can do a video consult with you where we go further into your history and really understand what's going on and give you the guidance of what to do, both from a physical therapy standpoint as well as from a medical standpoint. So, if this video resonated with you, if you finally feel like somebody understands you and you're getting some answers, like, share, subscribe, and definitely comment down below. We use your comments to create these other videos to hopefully answer many of your questions. The other thing is you're not alone. Please do not feel like you're the only person in the world that is going through this. Most of the men that I talk to feel like they are the only person on the planet. There's nothing hidden typically. It really is a musculoskeletal issue. So I hope this was helpful, and I hope this sheds some light on answers that you are looking for. And hopefully this is the last video you need to watch. So have a wonderful day, and we'll see you in the next video.